Hi, I'm here with Seward County Community College President Brad Bennett, and we are going to take a look at the new Student Health Center. How are you doing today, Brad?
Doing great. Good morning to everyone. We are absolutely just so excited about this project. This was a building that was our old dorms that became really ran down and became a storage unit over time. We had a bunch of junk in there, so we started a project to clean this out and really revisioned on what the space could be for our community and our campus. And so we're excited about it. It's actually two buildings in one, and so we are just so excited about the progress that we made, and we're getting closer to having this available for our students. So we'll go inside and take a look. The west side of this building is a student commons area that we'll show you, and then the east side is actually a student health center. So
all right, let's go.
So a few things about this area as you come in. This area will be our meeting area for our students. Just kind of a general area that they can reside in. Obviously the painting is going now, so we have a lot of tarps up. But we have this area, which is really going to be unique for our campus. This is going to be our movie room. So we'll have a giant TV on the east wall. We'll have some stadium seating for the students. This area, the student commons area, will be open 24/7 for our students. So they can come in here, stream a show, do their studying, and really have a true hangout area on campus. It was something that we were lacking, and our student numbers are up so much. We have so many more students on campus. We have to do some additional things to keep them engaged and really create that holistic student experience.
Right, and actually I was just going to say that, one of the biggest, most important for the students is the campus experience, and that means activities, and actually now that we have this area for them that they can call their own, it's pretty impressive. And I would go and challenge this, I'm sure you would too, is what community college, among four-year colleges has something like this? Yeah,
I was really excited when we came up with this idea, and we were able to design what it looked like, and to really have an area on campus that makes us different than the other schools is a huge blessing. So we are just so excited for it. I think that it'll change the student experience. It'll give them so many opportunities. We have a large number of students that come to us without vehicles. So to have stuff that's accessible to them on campus is just a big win. So
awesome. Okay.
All right. So this area will serve as our commons kitchen area. So this area will have a bunch of TVs up, some couches for students to hang out in. This area will actually be our kitchen area, a commons area for our students to be able to come in. You think about the number of students we have that don't have cars. Our cafeteria shuts down. We serve dinner 5 to 6:30, and that's it for the evening. So they will have ability to come in and prep food and be able to have a place to enjoy. We'll have a giant island out here with seating and stuff in it.
So we talking like stoves, ovens, or we talking microwaves?
Yeah, stovetop, refrigerator.
So really fully functional kitchen that they can actually cook something. Okay.
Yeah. So we are excited for that, and something that'll be really, really important for our students, and creating that student experience for our students that come here to live. This is their home, so they'll have more options. So.
And again, being here previous before, you had many international students, many students. So it's like, we'd love to cook for you, but there's nowhere in now. Absolutely. There is.
Yeah, absolutely. Yeah, and like I said, this whole west side of the student commons area will be open 24/7 for our students, and we will access it via our electronic locking system. So students have their student IDs, they'll have their access to this area. So we are absolutely ecstatic about it. So
okay.
So on the student commons area side, they will have their own restrooms, which are great. I think the tile with the green, that was a Brad Bennett call there. I think it turned out great. It's going to be really, really nice area for the students, and it will serve they'll serve this west side of this campus wall. And then as we walk to the east, the building actually separates. So at this door here will just be a maintenance access. So this door will remain locked, separating the student commons area from what is now the student, will become the student health center. So the student health center will have the same restrooms on each side as we enter this. The student health center has its own outside entrance, which is great. As you walk into the student health center, we'll have it'll look just like a doctor's office. We'll have a receptionist to schedule appointments, a waiting area. We're excited about this. We're able to do this with no additional staff. So this area, we don't need any more personnel. We're shifting people around. We'll be able to handle the needs of not only this scheduling, but really all the scheduling together from rooms across campus and buildings and all those things. So then within the student health center, and we purposely overbuilt this in size, and the thought process there is there an opportunity to bring a provider in here, maybe for our employees or
an additional provider,
or us in USD 480, and so we overbuilt it. We look at when you look at specs, a health clinic this size could serve about 1,500 to 2,000 patients over a year, and so where we don't serve near that many with our student population right now, we have that ability. The first room we have is just our break room for our folks. So we'll have refrigerators and cabinets and sinks and stuff in here. And then when we work towards the back of our student health center, we'll have 3 very similar exam rooms, patient exam rooms. We'll have the medical beds, cabinets, sinks, all those types of things that they're needed to do their jobs. I said we have 3 of those that are all essentially the mirror image of one another. Then we have this will be our testing center, so this will house our things that we need to do, our cultures and things like that. There's our 3rd exam room. This is the office for the mental health counselor that will serve as an office, and also she will
see patients in here.
That was one thing that we really talked into consideration in the planning process. We soundproofed all these rooms, and so there will be complete privacy in our exam rooms. And so that requires some additional installations and some things we did to make it soundproof. So what was being said, the mental health counselor wasn't being heard in other areas, and vice versa. So privacy is obviously a big deal in this area. So. And then our last office, which will serve as our work area, our office for our healthcare provider. Just a standard office, but again, a space to where they can, they have to do a lot of medical charting. There's a lot of stuff that they have to do that's required by their job. And we were really excited about this in dealing with sensitive situations, whether it's mental health with students or just healthcare in general. We were really excited that there was already a back entrance to this area. So, if our mental health counselor has a student that's really upset that is ready to leave, she can take them outside and leave the facility without having to go back through the entire building. So.
Correct.
So this is it. This is our student health center. It's something that I have not seen a facility like this at a community college our size, and so we are absolutely excited for it.
And one of the things is that I know that you had said that you're very, very invested in the student health center because you're very invested in student health. Obviously, we recently last year got a practitioner, a nurse practitioner on campus, and it's something that's really dear and deep to your heart.
It is. I just, being a dad of 2 girls, and you think about making that decision to send your child to a college, how they're going to handle that child is really important, and the services that they provide, and we are seeing a healthier campus because we have healthcare on our campus. We're seeing people not miss as much class when they get sick. They're getting the care that they need, and so it really is providing benefits to our students and our community, and we have a duty of care to take care of students when they come see us and provide the best experience possible. And we already do a great job at it, but this is another huge step in that direction.
And one of the biggest thing I think is that right now our nurse practitioner is on the tech campus. If you look out over here, you can sort of see that our dorms are right across the this area, and so I'm sorry. Right across this area, and it is, if there is something going on, they can just go from their dorms straight here, and there's no more excuses. I know that I think that we sort of seen that a lot of students didn't want to go all the way out over there, and now there's no excuse.
No, absolutely. That was one of the things that we talked about in this conversation was that we have an area on campus that is so valuable because access to the dorms. And so when we looked at this building, and when I first got here, I was told you have to tear the building down. It can't be, structurally. And so we hired a structural engineer, came in and said, no, structurally you're fine. We know we have some things to fix. And when we started working on this, it just became a clear that this should be the student health center, and that should be the student commons area. I mean, we talked about 100 different projects, and at the end of the day, this was the one that made the most sense for our campus, our community, and I'm so excited because I wish we probably should have done this video before we started cleaning it out because there was just junk everywhere. And so we took a junk area on campus, and now it's going to turn into a beautiful facility. And I think about some of these projects. There's so much work right now. They take incredible amount of time. But I think hopefully it's long down the road. But I just think about that next president walking around, and they're gonna have that thought that I'm really glad we have that on our campus, and someone thought about that, someone put the work into to get it done. Just like with Dr. Dunn, Dr. Chaska looking at our allied health program, the same type of deal. Like what a smart decision that was. And so these projects are exhausting to take it out of you, but you look at the long term value to the community college is so important.
Exactly. It's not just tomorrow. It's just not 5 years. Actually, you're talking 10, 15, 20 years, Absolutely. 25 down the line. And it's like, how could we not have this? And people will eventually take this for granted. Absolutely. So, and not realizing that 50 years, we never had one.
Absolutely. So we're excited. I think we'll probably be in here within 4 to 6 weeks, I'm guessing. So we're getting close. So the paint went up this week, and cabinets will be going in soon, so we're not too far off from actually cutting the ribbon and opening it up.
All right, President Bennett, anything else you want to add?
No, we thank everyone's support, and if you would like a tour or something, just give me a shout and we'll show you around.